Hello, Sharon Rivers here at Wake Forest Baptist High Point Medical Center. Did you know that heart attacks have beginnings? Like other illnesses and diseases such as cancer, diabetes, a cold or the flu, there are early warning signs that can let you know that something may be about to happen, that you're about to get sick. Well, the same way with heart attacks. 750,000 Americans each year have a heart attack. And over 50% of those are not aware or don't recognize the early warning signs. So we're going to talk about early heart attack care. And the message is simple. It's learning to recognize the early warning signs and symptoms and learning to respond in what to do and what is appropriate. So first, let's go over the heart attack risk factors. There are several heart attack risk factors, such as having a family history of coronary artery disease, having high blood pressure or high cholesterol, smoking, a sedentary lifestyle, obesity, and being overweight. These are all factors that can put you at risk for a heart attack. So now that we know the risk, then we can better modify our lifestyle and reduce our risk for heart attack. Now let's talk about the signs and symptoms of heart attack. There are specific and non-specific signs. So the specific signs are chest pain, chest discomfort, burning and aching in the chest, and a feeling of fullness. So those would be very specific and would alert you to know that something is truly wrong. More non-specific would be that you might feel dizzy, or you may feel nauseated, or you're sweating. These are more mild symptoms that could occur, and the mild symptoms could actually happen. They could come and go over a period of hours, days, or weeks. So these are the really early warning signs that you may not be aware of. So what causes a heart attack, you may wonder? Well, the heart is a great pump of the body, and there are three main arteries that supply the blood. So when the blood supply gets blocked, then that is the heart attack. When the blood flow is interrupted, that's the heart attack. Cardiac arrest, some wonder if these are the same things. Well, they're not the same. A heart attack is a circulation problem, and cardiac arrest is an electrical problem. In cardiac arrest, is an electrical malfunction of the heart, which causes the heart to stop beating or stop pumping properly. So the blood supply is interfered with, but it is different because the heart attack is actually a blood flow problem where the artery is blocked. So there are a couple of other symptoms that you need to be aware of. An atypical presentation of a heart attack, which would mean not the normal chest pain or the nausea or dizziness or shortness of breath. These could be even more subtle presentations where you wouldn't think that it had anything to do with your heart, such as like back pain or pain that travels from your back to other parts of your body, or jaw pain even. Now that we know about the early warning signs and we can recognize the signs and symptoms of a heart attack, we're going to talk about how to respond. So how to respond. There are three types of heart attacks, and we're going to go through each one and talk about what you would do in the situation. So type 1 heart attack is the kind that stops you in your tracks. And this is called the CPR scene. If you are the bystander in this situation and someone just collapses and they're having a heart attack, then you would immediately take your phone, you're going to call 911, and then you're going to immediately start CPR. And hands-only CPR, everyone can learn how to do this, and is very important to start this because it really helps the person's survival rate. What you would do is the person is either on the ground, on a hard flat surface, or on a table, a desk, wherever they are, a hard flat surface. You're going to put your hands in the center of the chest, and then you're going to pump. You're going to pump hard and fast, keeping your arms straight. Starting CPR is so important. It really increases their chance of survival. The second type of heart attack, well, this is type 2, and this is where a person is feeling intense chest pain, severe chest pain, discomfort in the chest. And what you would do is you would call 911, And then you are going to remain with the person and you're going to keep them calm because they're probably going to be in pretty severe pain, and you're going to stay with them until medical help arrives. The third type of heart attack, and that's where the early heart attack education comes in handy. And it's most beneficial is because you have learned the early warning signs and symptoms, and you are learning how to respond and what to do to help this person. In this situation, a person may experience an early warning sign, and they may have a shortness of breath or feel dizzy or sweating or any one of the symptoms. But if the symptom doesn't last and it goes away, well, in this case, all of us, we would probably have the tendency to deny that there's something wrong with us, because no one has time to be sick. And everyone tends to think that they're too busy. And if it goes away, they're just going to try to ignore it. Well, that's where this is important, that you learn, that you know the early warning signs and symptoms, and that you can let them know that these could be early warning signs. And you would urge them to go and get checked out. You would help them to get to the doctor, to an urgent care or an emergency room, because at this point, they are going to be heavily trying to deny the situation. But it's important that you remain persistent with them and follow up. And that's what early heart attack care is all about, is learning to recognize the early warning signs and symptoms and to respond appropriately. Also, another thing that is an important piece of information that people won't understand or won't know is that during even the early warning signs, if this means a heart attack is beginning, because like I said, that heart attacks do have beginnings, that most heart damage occurs within the first 2 hours. So it's really important not to ignore any of the signs. So to summarize one more time, we've gone over how to recognize the early warning signs and symptoms and how to respond appropriately to help the person. And by learning these things and sharing and spreading this education, you can help save a life. Not only help save a life, but your hands-only CPR can help save the quality of a life. Thank you for listening to this today. And for more information, you can go on deputyheartattack.acc.org and to cprheart.org. Thank you.